Good evening, one and all. Good evening, one and all. We welcome you to the international seminar on HIV, AIDS, art, therapy, immunity, medication, treatment, rehabilitation, prevention, awareness, early intervention, stigma, health, well-being, and sustainable development 2022. Commemorating Azadi Ka Amrit Mahotsav, nation celebrating 75 years of independence, and United Nations Sustainable Development Goals SDGs 2015 to 2030 as part of awareness and campaigns, and also commemorating World's AIDS Day today on 1st December in collaboration with Sri Holistic Health Foundation India and Sri Research Institute and Center for Art Sciences and Well-being. So before we start our session, let's take the blessings of Almighty.
कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः
With the blessings of Almighty, we shall continue with today's sessions. Today is World's AIDS Day, which is commemorated on 1st December every year. This year, the theme for the World AIDS Day is Equalize. Every year, on 1st December, the world commemorates World AIDS Day. People around the world unite to show support for people living with and affected by HIV, and do remember those who lost their lives to AIDS. The inequalities which perpetuate the AIDS pandemic are not invitable. We can tackle them. The World AIDS Day UNIAIDS, United Nations AIDS is urging each of us to address the inequalities which are holding back progress in ending AIDS. The Equalize slogan is a call to action. It is a prompt for all of us to work for the proven practical actions needed to address inequalities and help end AIDS. Data from UNAIDS on the global HIV response levels that during last 2 years of COVID-19 and other global crises, progress against the HIV pandemic has faltered, resources have shrunk, and millions of lives are at risk as a result. We have only 8 years left before 2030 goal of ending AIDS as a global health threat. Economic, social, cultural, and legal inequalities must be addressed as a matter of urgency. In a pandemic, inequalities exacerbate the dangers for everyone. Indeed, the end of AIDS can only be achieved if we tackle the inequalities which drive it. World leaders need to act with bold and accountable leadership, and all of us everywhere must do all we can to help tackle inequalities too. The recent report, Dangerous Inequalities, by the UNAIDS World AIDS Day Report 2022, reveals that inequalities are obstructing the end of AIDS. On current trends, the world will not meet agreed global targets on AIDS. Millions of lives are at stake. The new UNAIDS report shows that only urgent action to tackle inequalities can get the world AIDS response on track. It shows how world leaders can tackle those inequalities and calls on them to be courageous in doing so. Over the years, a detailed understanding of HIV epidemic has emerged through the collection, analysis, and dissemination of data, helping programs to reach the right people in the right place at the right time. Having high quality data on AIDS response has enabled ambitious, measurable, and time-bound targets to be set for tackling progress and ensuring accountability. World's AIDS Day is celebrated around the world on December 1st each year. It has become one of the most recognized international health days and a key opportunity to raise awareness, commemorate those who have passed on, and celebrate victories such as increased access to treatment and prevention services. UNAIDS looked the need on campaigning for World AIDS Day from its creation until 2004. From 2004 onwards, the World's AIDS Campaigns Global Steering Committee began selecting a theme for the World AIDS Day in consultation with civil society, organizations, and government agencies involved in the AIDS response. Themes run for 1 or 2 years and are not just specific to World AIDS Day. Campaigning slogans such as Stop AIDS, Keep the Promise have been used year round to hold governments accountable for their HIV and AIDS related commitments. Within the UN system, UN AIDS is a leading global effort to end AIDS as a public health threat by 2030 as part of Sustainable Development Goals. Since it started operations in 1996, UN AIDS has led and inspired global, regional, national, and local leadership, innovation, and partnership to ultimately consign HIV to history. The inequalities which perpetuate the AIDS pandemic are not inevitable. We can tackle them. The World AIDS Day, 1st December. UN AIDS is urging each of us to address the inequalities which are holding back progress in ending AIDS. The Equalize slogan is call to action, and it is prompt for all of us to work for the proven practical actions needed to address the inequalities and help end AIDS. These include increased availability, quality, and suitability of services for HIV treatment, testing, and prevention so that everyone is well served, reform laws, policies, and practices to tackle the stigma and exclusion faced by the people living with HIV and by key and marginalized populations so that everyone is shown respect and is welcome. Ensure the sharing of technology to enable equal access to the best HIV science between communities and between the global south and north. Communities will be able to make up of and adapt the equalized message to highlight the particular inequalities they face and to press the actions needed to address them. Data from UNAIDS on the global HIV response reveals that during the last 2 years of COVID-19 and other global crises, progress against HIV pandemic has faltered, resources have shrunk, and millions of lives are at risk as a result. So, 4 decades into HIV response, inequalities still persist for the most basic services like testing, treatment, and condoms, and even more so for new technologies. Young women in African region disproportionately affected by HIV, while coverage of dedicated programs for them remains too low. In 19 high burden countries in Africa, dedicated combination prevention programs for adults and girls and young women are operating in only 40% of the high HIV incidence locations. Only a third of people in key populations, including gay men and other men who have sex with men, transgender people, people who use drugs, sex workers, and prisoners, have regular prevention access. Key populations face major legal barriers, including criminalization, discrimination, and stigma. We have only 8 years left before 2030 goal of ending AIDS as a global health threat. So economic, social, cultural, and legal inequalities must be addressed as a matter of urgency. In a pandemic, inequalities exacerbate the dangers for everyone. Indeed, the end of AIDS can only be achieved if we tackle the inequalities which drive it. World leaders need to act with a bold and accountable leadership, and all of us everywhere must do all we can help to tackle inequalities too. We can end AIDS if we end inequalities which perpetuate it. The World AIDS Day, we need everyone to get involved in sharing the message that we all benefit when we tackle inequalities. To keep everyone safe, to protect everyone's health, we need to equalize. On this occasion of World AIDS Day 2022, the global HIV response is in danger. Even as HIV remains as a major public health issue that affects millions of people worldwide, over the last few years, progress towards HIV goals has stalled. Resources have shrunk and millions of lives are at risk as a result. Division, disparity, and disregard for human rights are among the failures that allowed HIV to become and remain a global health crisis. On 1st December, World Health Organization, United Nations joins partners to commemorate World AIDS Day 2022 under the theme Equalize. The World Health Organization is calling on global leaders and citizens to boldly recognize and address the inequalities which are holding back progress in ending AIDS and equalize access to essential HIV services, particularly for children and key populations and their partners, men who have sex with men, transgender people, people who use drugs, sex workers, and people in prisons. So, renewing our commitment to end HIV, persistent economic, social, cultural, and legal inequalities and challenges posed by the COVID 19 pandemic and other global crises requires renewed efforts to maintain visibility for HIV to end AIDS as a public health threat. Focusing on equality, inequality still persists for most basic services like testing and treatment. We must ensure that everyone, everywhere, has equal access to HIV prevention, testing, treatment, and care. Health services should be adapted to reach and meet the needs of the population most at risk and affected, and this includes implementing a zero tolerance policy to stigma and discrimination in all health services and elimination litmus test children and key populations. World Health Organization recommends a renewed focus on populations that have been left behind in the global response to HIV and AIDS. Only 52% of children living with HIV are on life-saving treatment. If we can show progress in ending new infections among children, the ensuring all are quality antiretrovirals. Only 52% of children living with HIV are on life-saving treatment. So, as mentioned, only 52% of the children living with HIV are on life-saving treatment. If we can show progress in ending new infections among children and ensuring all are on quality antiretrovirals, in short ARVs, we have greater hope and can ensure greater political commitment to end AIDS in all populations by 2030. Globally, 70% of new infections are among people who are marginalized and often criminalized. We can only end AIDS by scaling up HIV services and removing structural barriers and stigma and discrimination of key populations in every country. If you look at the key facts or statistics, to reach the new proposed global 95-95-95 target set by the UNAIDS, we will need to redouble our efforts to avoid the worst case scenario of 7.7 million HIV-related deaths over the next 10 years. Increasing HIV infections due to HIV service disruptions during COVID-19 and the slowing public health response to HIV. HIV continues to be a major global public health issue, having claimed 40.1 million, that is 33.6 to 48.6 million lives so far. In 2021, 6,50,000 people died from HIV-related causes and 1.5 million people acquired HIV. There is no cure for HIV infection. However, the increasing access to effective HIV prevention, diagnosis, treatment, and care, including for opportunistic infections, HIV infection has become a manageable chronic health condition, enabling people living with HIV to lead long and healthy lives. There were an estimated 38.4 million people living with HIV at the end of 2021, two-thirds of whom 25.6 million are in the World Health Organization African region. The human immunodeficiency virus, HIV, targets the immune system and weakens people's defense against many infections and some types of cancer that people with healthy immune systems can more easily fight off, as the virus destroys and impairs functions of immune cells. Infected individuals gradually becoming immunodeficient. Immune function is typically measured by CD4 cell count. The most advanced stage of HIV infection is acquired immunodeficiency syndrome, in short known as AIDS, which can take many years to develop if not treated. Depending on the individual, AIDS is defined by the development of certain cancers, infections, or other severe long-term clinical manifestations. So, what are the signs and symptoms? The symptoms of HIV vary depending on the stage of infection. Though people living with HIV tend to be most infectious in the first few months after being infected, many are unaware of their status until the later stages. In the first few weeks after initial infection, people may experience no symptoms or an influenza like illness, including fever, headache, rash, or sore throat. As the infection progressively weakens the immune system, They can also develop other signs and symptoms, such as swollen lymph nodes, weight loss, fever, diarrhea, and cough. Without treatment, they could also develop severe illness, such as tuberculosis, cryptococcal meningitis, severe bacterial infections, and cancers such as lymphomas and Kaposi Sacker. Transmission. There are different ways of transmission. HIV can be transmitted via the exchange of variety of body fluids from infected people, such as blood, breast milk, semen, and vaginal secretions. HIV can also be transmitted from mother to her child during pregnancy and delivery. Individuals cannot become infected through ordinary day-to-day contact, such as kissing, hugging, shaking hands, or sharing personal objects, food, or water. It is important to note that people with HIV who are taking ART and are virally suppressed do not transmit HIV to their sexual partners. Early access to ART and support to remain on treatment is therefore critical, not only to improve the health of the people with HIV, but also to prevent HIV transmissions. And there are various risk factors, which includes behaviors and conditions that put individuals at greater risk of contracting HIV, which include having condomless anal or vaginal sex, having another sexually transmitted infection, STI, such as syphilis, herpes, chlamydia, gonorrhea, and bacterial vaginosis, engaging in harmful use of alcohol and drugs in the context of sexual behavior, sharing contaminated needles, syringes, and other injecting equipment and drug solutions when injecting drugs, receiving unsafe injections, blood transfusions, and tissue transplantation, and medical procedures that involve unsterile cutting or piercing, and experiencing accidental needle stick injuries, including among health workers. So, how do we diagnose? HIV can be diagnosed through rapid diagnostic tests that provide same-day results. This greatly facilitates early diagnosis and the linkage with treatment and care. People can also use HIV self-test to test themselves. However, no single test can provide a full HIV positive diagnosis. Confirmatory testing is required, conducted by a qualified and trained health or community worker at a community center or clinic. HIV infection can be detected with great accuracy using World Health Organization pre-qualified test with a nationally approved testing strategy and algorithm. So most widely used HIV diagnostic tests detect antibodies produced by the person as part of their immune response to the fight HIV. In most cases, people develop antibodies to HIV within 28 days of infection. During this time, people experience the so-called window period, when HIV antibodies haven't been produced in high enough levels to be detected by standard tests, and when they may have had no signs of HIV infection, but also when they may transmit HIV to others. After infection, without treatment and a viral suppression, an individual may transmit after infection without treatment and viral suppression. An individual may transmit HIV transmission to a sexual or drug sharing partner, and for pregnant women to their infant during pregnancy, or the breastfeeding period. So, following a positive diagnosis, people should be retested before they are enrolled in the treatment and care to rule out any potential testing or reporting prior to starting lifelong treatment. It is important to support people with HIV to stay on treatment, provide counseling messages, and while testing for adolescents and adults have been made simple and efficient. This is not the case for babies born to HIV positive mothers. For children less than 18 months of age, rapid antibody testing is not sufficient to identify HIV infection. Virological testing must be provided as early as birth or at 6 weeks of age. New technologies are now available to perform this test at a point care and enable same day results, which will accelerate appropriate linkage with the treatment and care. How do we prevent? Individuals can reduce the risk of HIV infection by limiting exposure to risk factors. Key approaches for HIV prevention, which are often used in combination, include male and female condom use, prevention, breasting, and counseling for HIV and STIs, voluntary medical male circumcision, in short known as VMMC, use of antiretroviral drugs, ARVs, for 2000. Use of antiretroviral drugs, ARVs, for prevention, and oral PrEP and long-acting products that and use of various products like dapivirine, vaginal ring, and injectable long-acting cabotegravir, harm reduction for the people who inject and use drugs, and elimination of mother-to-child transmission, in short known as MTCT, of HIV. HIV is not transmitted if a personal sexual partner is virally suppressed on ART, so increasing access to the testing and supporting linkage to ART is an important component of HIV prevention. So, what are the various other options or various options for treatment? HIV disease can be managed by treating regimens composed of a combination of antiretroviral drugs. Currently, antiretroviral therapy, in short known as ART, does not cure HIV infection but suppresses viral replication and allows an individual's immune system recovery to strengthen and regain the capacity to fight off opportunistic infections and some cancers. Since 2016, Since 2016, World Health Organization has recommended treat all, that all people living with the HIV be provided with lifelong ART, including children, adolescents, adults, and pregnant and breastfeeding women, regardless of clinical status or CD4 cell count. By June 2022, 189 countries has already adopted this recommendation, covering 99% of the people living with HIV globally. In addition to the treat all strategy, World Health Organization globally, 28.7 million people living with HIV were receiving ART in 2021. Global ART coverage was 75% in 2021. However, more efforts are needed to scale up treatment and particularly globally, 28.7 million people living with HIV were receiving ART in 2021. Global ART coverage was 75% in 2021. However, more efforts are needed to scale up treatment, particularly for children and adolescents. Only 52% of children 0 to 14 years were receiving ART at the end of 2021. Advanced HIV diseases remains a persistent problem. In the HIV response, people continue to present or represent for care with advanced immune suppression, putting them at a higher risk of developing opportunistic infections, which is supporting countries to implement the advanced HIV disease package at the So the 2022 and 2030 strategies recommended, shared, and disease-specific country actions supported by the actions by World Health Organization and partners. They consider the epidemiological, technological, and contextual shifts of previous years, foster learnings across the disease areas, and create opportunities to leverage innovations and new knowledge for the effective responses of HIV, viral. The strategies call for precise focus to reach the people most affected and at risk for each disease that address inequalities. They promote synergies under a universal health coverage and primary health care framework. The 75th World Health Assembly requested progress reports on the implementation of strategies in 2024, 2026, 2028, and 2031. Nothing that the notes 2026 report will provide a midterm review based on the progress made in the meeting the strategies. The strategic directions of the GHSS 2022 to 2030 are to deliver people-centered evidence-based services, optimize systems, sectors, and partnerships for impact, generate and use data to drive decisions for action, engage empowered communities and civil society, foster innovation for a care or accelerated action. As the funding co-sponsor the UN AIDS Joint Program, World Health Organization takes the lead on HIV testing, treatment, and care presented. As a founding co-sponsor, the UN AIDS Joint Program, World Health Organization takes the lead on HIV testing, treatment, and care. Persistence of HIV evidence. As a founding co-sponsor of UNIAIDS Joint Program, which are easily led by H. Stanford, so with this, we shall end the commemoration of the HIV, that is human immunodeficiency virus, in short known as HIV. So quickly fill up the feedback form for session 1, then we will move on to other sessions. Dear friends, there is no feedback link. Feedback form is shared in the form of polls within the Zoom platform. So kindly fill up the feedback form. From the options, you can find the feedback form, or in the poll section, you can see the feedback form option. If you have accidentally closed, dear friends, quickly fill the feedback form so that we can move on to next session. After each session, there will be feedback form, and we have 5 minutes to fill the feedback form. So quickly attend to the feedback form immediately after session. If you have any queries, you can raise your hand. We'll take up any queries after the session. While session is going on, you can also use the chat box to share your query so that after session we can address your query or concern or your observations. Now we will be moving on to our next session by Dr. Vidya Hari Iyer. She is a dentist, multi-talented personality, woman entrepreneur, a classical singer and dancer. and she has presented in various webinars platforms, and she would be presenting on oral health care for HIV disease. Welcome you, ma'am, and over to you for your presentation. You can minimize the polls window, ma'am, without closing it, so that participants can keep attending to the feedback form while session is also going on. And you can start your audio video.
Can you see me, sir? Can you hear me?
Yes, ma'am.
Okay. Can I start the session?
Yeah, ma'am. Welcome. Please go ahead.
Thank you. Thank you so much, Ravindra sir and Mary, for this wonderful opportunity. It's lovely to be back with all of you. Today is World AIDS Day, and we have a lot of information which Ravindra sir has shared. And I'm going to throw a lot more insights on the oral care. So I'm going to start sharing my presentation right away. Are you able to see the presentation, sir?
Yes, ma'am. Please continue.
Is it visible full screen?
Yes, ma'am. Yeah, it's fine. You can continue.
Now it's fine, no, sir? Okay. Okay. So good evening, friends, once again, and welcome to this wonderful seminar. And today we are going to talk about a topic called oral health care for HIV disease. So the World AIDS Day is commemorated on December 1st. And the theme for this year, that is 2022, is putting ourselves to the test, achieving equity to end HIV. So Ravindra sir has already given you the basic information in the first 1 hour of today's session. So I'm going to take you through a journey where you will be able to see and understand a little more from the dentist point of view and the oral lesions which happen when a person has HIV and AIDS, right? So acquired immunodeficiency syndrome is AIDS. Acquired means it is given from somebody. Immunodeficiency means their immunity compromised, and it's a syndrome, which means there are multiple things which happens inside the body. This is a chronic, potentially life-threatening condition caused by the human immunodeficiency virus, which is called the HIV. So it's chronic, which means it takes time for the body to have all the cells affected by this virus. And in a case, it is in the initial stage where, the prolongevity of a life can take place. That is also given because of the drug therapy, which again, Ravindra Sarji has said. By damaging our immune system, the HIV interferes with the body's ability to fight infection and disease. And that is why AIDS and HIV was a very big, it created a lot of commotion the same way like we had the pandemic 2 years back, right? So how did the spread start? It was probably passed to humans when the humans hunted, chimpanzees for meat, and they came in contact with the infected blood. And over decades, if you look at it, HIV has slowly spread across Africa and later into other parts of the world. And the virus actually started, showing its face way back almost around, 50 years back. So you can understand that this is some, disease that we are trying to work on for a very long time. HIV can spread through the contact of infected blood or any secretions by the human body. So it could be the semen or the vaginal fluids. And as the virus multiplies and destroys all the immune cells, the symptoms may, can develop, such as fever, fatigue. Fatigue means tiredness, and swollen lymph nodes. Usually you will see them on the jaws on either side. HIV damages the immune system and interferes with the body's ability to fight any infection and disease. And this flu, you will see that the symptoms starts around 2 to 4 weeks after they get infected with the virus. And there is no cure for HIV, and that is why the spread of awareness is very, very important. But medications can control the infection and prevent the disease progression, and thereby you see there the quality of life can be improved than what if there was no drug intervention it would have been. So people taking this HIV medications may not have other symptoms even for years, and if they are not treated, so if untreated, the HIV typically turns into AIDS in about 8 to 10 years. So just let's see what are the mode of spread. So you can spread through the tears, through the saliva, through breast, through the CSF, which is the cerebrospinal fluid. You have the cervical secretion, or through urine in women. For the men, it could be tears, saliva, blood, again can be done even through women, the blood lymphocytes, the CSF fluid, and urine and semen. And the World Health Organization actually, during the COVID-19, they found that as it is when you are having comorbidities, like, we had a lot of sessions on the pandemic. So understanding the virus, we understood that, the first thing was diabetes, hypertension, obesity, respiratory problems. And in addition, if you're already immunity compromised, like in the case of an HIV, there must be patients who must be given access to the COVID-19 vaccination and services. And that is why this year's theme is End Inequalities, End AIDS. So what are the symptoms of acute HIV? The patients could have fever, they could have body chills, headaches, night sweats, sore throat, muscle aches and pains, joint pains, fatigue, swollen lymph nodes, mainly on the neck region, and mouth ulcers. So I'm going to share certain pictures which will help you understand in the oral cavity, especially how a dentist would see a patients who have HIV or AIDS. So if you look at how is the spread or the progression, you will see before the HIV infection, you have the normal immunity-based cells. But however, once they have an acute phase, you will see that the infection actually starts to spread and you have the HIV virus getting into the bloodstream. And in the initial phases, you will have only few of them. But as the cases advances, you will see more of the HIV virus, and that is how it becomes AIDS. So there's currently, as I told you, there's no cure for HIV, but there are very effective drug treatments that enable most people with the virus to live a long and healthy life. So early diagnosis and prevention and probably effective treatments are the only options left for us to help these people have a normal lifespan or a near normal lifespan. So it's our duty to stop HIV and stop AIDS. And today I'm going to take you through a journey into the oral lesions. So let's start first with the periodontal disease. Periodontal means gum-related infection. So here you will see the HIV-associated gingivitis. Gingivitis is gingiva is the gums, and gingivitis is inflammation of the gums. So here they will be very immunity compromised. So it can only be on the gums, or it can move on to the gums and the bone. So that is when we call it the HIV-associated periodontitis. And these are seen exclusively in HIV infected persons. So we have periodontal disease which occurs in other patients also, normal people, but people who are affected with the virus, you will see more reddishness of their gums. Now, in some cases, this HIV-P, which means periodontal disease, where then that has gone into the tissue and into the bone, this can result in necrotizing stomatitis of periodontal origin. Necrotizing means it will actually start eating away. So you will see that the patient has, intense pain and bigger pockets or bigger, when we take an instrument and go between the teeth and the gums, you will see the instrument sinking much more, and you will also see a lot of mobility of teeth. So what is the line of treatment? We give metronidazole, which is very effective in adjunct systemic antibiotic. So it will work on the other areas of the body too, and also given for the periodontal disease in patients with HIV. So there were studies by Winkler and Robertson since 1992. And metronidazole is an effective gram-negative bacteria that they are typically involved in the periodontal disease. So we give metronidazole even in other patients, but here it is also very effective with adjunct systemic antibiotic treatment. Next is xerostomia. Xerostomia basically means there is less saliva in the oral cavity. So most of us, when you can understand, when we eat food or when even thinking about eating food, there'll be a lot of water coming in your mouth. So that is your saliva. Especially when we go to sleep in the night, we will not have much of saliva in the oral cavity, right? But when we are through the day, when we talk, when we are eating, you will have a lot of saliva. So imagine there are no saliva or very little saliva in the oral cavity, then you will see a lot of dryness in the mouth. There'll be a lot of itchiness in the mouth. And it will be very, very difficult for these patients to even take care of their oral hygiene. So let's see what we need to do when a patient has xerostomia. We can give them some sugar-free, gums. Why sugar-free? Because these patients are already prone to dental caries or cavities. So if you're going to give sugar-laden chewing gums, then the attack or the infection as in causing dental caries will also increase. That is why we give sugar-free gums. Next is to limit your caffeine intake, because caffeine also makes your mouth a little more drier, and use mouthwashes that contain alcohol. So you need to avoid using these alcohol, because alcohol again causes drying. And you can use a lot of tangy, tasty, fruits, something like lime, but don't make it too acidic, because that is again going to cause them dental caries. Next is to stop all habits. In case you're a tobacco user, smoker, chewer, you need to stop it completely, and try to sip water regularly so that there is a constant amount of water in your oral cavity. Thereby you don't feel the dryness, and you can also take some saliva substitutes, and these substitutes have xylitol, so these can also propagate some amount of saliva. And you should avoid using over-the-counter antihistamines and decongestants. Again, you can see that when you take around the counter without telling them, the pharmacist, what will happen is it will again make it more dry. It will just worsen your condition. And try to breathe through your nose, not through the mouth. That's very important instruction we give to patients who have HIV. And avoid just being in a very, very dry areas. So you can add moisture to the air at night. You can have a room humidifier so that there is some kind of a water content. Sometimes even the skin, if you look at it, it will become very stretchy. They would have some bleeding spots also. And avoid sugary or acidic foods and drinks. I told you sugary will again increase dental caries, and if it's acidic also it will increase dental caries. And when you brush, have a proper toothbrush, and use a fluoride toothpaste also. Excuse me. So you can have fluoride toothpaste. Now, fluoride toothpaste will prevent dental caries. You have even fluoride mouth rinses, which you can use. You have gel types. So when you have these gel types, what will happen is it will create some kind of a salivation, and that will help you, and you can use this just before bedtime. And definitely you need to visit your dentist at least twice a year, and this will help them detect early spots of dental caries and other dental issues, so that we all know prevention is better than cure, but even early detection also can reduce the amount of problems also. Next is oral candidiasis. Now, whenever there is an immunity compromise in a patient, what will happen is you will have these candida or a fungal infection in the oral cavity. Now, these fungal infections happen when the immunity is low, and you will see like a white carpet either over the tongue, over the soft palate, or over the cheeks. So this again, if you look at it, it is generally called as oral thrush, and it is more seen in patients even when we fall sick with fever and we have not taken care of ourselves. You will see this kind of a white layer over the tongue, right? So you will see this affecting all over. Sometimes it can even go down to your esophagus, and oral and pharyngeal candidiasis is very is a when you look at the patient, is a clear indicator of the oral manifestation of the HIV infection. And in women, you will see that it is not only in the oral cavity, you can see them even in the vulvo-vaginal candidiasis. But we give generally antifungal drugs and therapies for this. And with both these applications, we see that, the patients definitely respond well to the treatment. Next is oral hairy leukoplakia. So oral hairy leukoplakia is a condition which is triggered by the Epstein-Barr virus, or the EBV as we call it. This causes again white patches on the tongue, and sometimes these patches can happen even on the other areas of the mouth. So these patches make the tongue or any other area look very hairy in nature. Generally, we don't need any treatment for this because patients don't have any other symptoms. However, when we start giving kind of immunity boosting medication, we will see that, these lesions come down, and sometimes they even disappear. We should remove any other source of irritation also. If they have any sharp tongue, sharp teeth, which is, trying to scratch the tongue or hurt the tongue. If we have any fillings or anything, again, which needs to be modified because they are sharp, all that will have to be taken care of. So you need to visit your dentist again, and in case you have any other symptoms along with the oral hairy leukoplakia, then your dentist will also see to boost up your immunity. So let me just tell you the difference between oral candidiasis and leukoplakia. So for oral candidiasis, if you take a cotton, or let me say a gauze, and we just clean it or wipe your tongue or the area, you will see that it just goes away, and only an erythema or a reddened area would be there. Whereas when you look at the leukoplakia, this cannot be brushed. So even if you take your cotton or a gauze swab and clean, it will not go away. So that was your leukoplakia. And when we have leukoplakia, when we see patients with leukoplakia, we also understand that we need to take a biopsy and see that it is not progressing into any malignancy or cancerous lesions. Next is sialadenosis. So here, if you just palpate your ears, we have the salivary glands. So just in front of the ear, if you take your hand and just place it, and as you talk, you will see the salivary, the muscles moving out and in. So as you hold it, you will see we have the major salivary glands and the minor salivary glands. So the major salivary glands also can get affected. You will see a kind of a swelling very close to the ear. So if we see the ear is actually lifting up, we check up for all these kind of lesions. Now, HIV, the sialadenosis affects the minor salivary glands with the labial salivary glands. Labial means external, demonstrating features of sialadenitis. And this, if you look at it, it is seen in 1 to 10% of the HIV infected patients, and you will have a salivary gland enlargement. So we generally palpate, we put one finger inside the mouth, one outside, and we see we try to palpate on either side of the mouth and try to figure out whether there is a difference in any of the sides. The parotid swelling in patients with HIV is often associated with the salivary gland disease, including the benign lymphoepithelial cyst. So you could have some cysts also associated there, and there could be stones also, and this could itself cause pain and swelling. And as I told you, xerostomia, so there is less of salivation. Having these stones also can stop further salivation, and so we need to rehydrate these areas. So and ask the patients to absolutely avoid things which can dehydrate their mouth. So smoking is one such thing, and even when we take certain drugs, that can also lead to xerostomia. So we need to be very careful. So what are the treatments for sialadenosis? You can massage that area, give some heat application, and in worst cases, we need to even do surgical removal of the cysts or of the the stones which have been formed. Next is herpes simplex. Herpes simplex is common in many people, but in people with HIV, outbreaks may be frequent and more severe. You will see these kind of viral infection on the side of your lips. You will also see them in the opening areas of your mouth. You can even see them inside your oral cavity, and these are highly painful. Taking antiviral oral medications like acyclovir, famiclovir, and valacyclovir, all these are traditionally used and they are most effective. You can also put some topical ointments applications on the external aspect, again with the same combinations, and for pain reductions and kind of just feeling comfortable, especially before you eat and talk, we can also give some anti-inflammatory or analgesic topical anesthetic so that the pain or the symptoms can get reduced. Next is the Kaposi sarcoma. So Kaposi sarcoma is one of the main types of cancer which affects the people with HIV. It progresses very quickly if it is not treated. So it can usually be treated by taking the antiviral drugs. So we call it the combination drug therapy or the combination antiretroviral therapy. And this classic Kaposi sarcoma, it grows as slow as possible. And these lesions are often treated with surgery, radiation therapy, or any other local treatment like intralesional chemotherapy. And chemotherapy may be used for widespread even skin lesions, or for the Kaposi sarcoma that has gone into the lymph nodes, the lungs, or the digestive tract also. Next is the human papilloma virus warts. Now, these warts will be seen in your, vagina, in your penis. It also would be there in some skin areas, in areas where you have moist membranes. And this, if you look at it, it can occur as verrucas or genital warts or any abnormal cell changes in your cervix. So as I told you again, there is no cure for HPV. However, vaccines are available to prevent the infections. And again, if you look at it, if you don't treat, it can lead to malignancy or cancerous lesions. And hence, early detection and prevention is again better. So let's stop HIV together, my dear friends. This entire month, from the 1st of December to the 31st of December, is the International AIDS Awareness Month. So let's see what can we do about it, right? Definitely, if there are any of these symptoms, early diagnosis and assessment, HIV testing and treatment needs to be followed. Never share needles or use only sterile needles. So you see, even when you go to doctors or when you're drawing blood, see that they open fresh needles in front of your eyes. Provide antiretroviral treatment in case affected. Early treatment of HIV-infected pregnant women if it has been through the sexual partner. Avoid unprotected sex. This holds good for all types of people. And when you are an HIV-infected mother, you should never feed your baby with your breast milk because the virus spreads. So you always feed them with the formula milk. So these are the 5 ways you can help end HIV and AIDS, which is the theme of this year's day. So first is to know the facts about the HIV and AIDS. That is can be done only by creating awareness like these workshops which have been planned. Talk, start the conversation, make the people understand what they have to do. Protect yourself and those whom you love. Test yourself to just know your status if you have not had or adhered to the moral ethics, and treat, stay healthy and protect others. We also know other ways where HIV has spread, not only through sexual contact. So we need to create a lot of awareness. That's the only way we can put an end to this. With that, I come to the end of my presentation. Thank you, Ravindra sir and Mary, for this wonderful opportunity. Any questions? I'll be there to answer. Thank you for a patient listening, my dear friends. Over to you. Any questions, sir? Can you hear me, sir? Any questions, my dear friends? Any questions?
Thank you, ma'am, for the wonderful session. And dear friends, if you have any queries, feel free to raise your hand or use chat box, or you can unmute yourself and ask if you have any queries.
Hi, ma'am. It is a very good presentation, but I have not heard about oral health, but I know only about this ART therapy, which was I worked in the HIV clinic in giving counseling in ART. This one, we have worked as a in KSEP's Karnataka AIDS Prevention Society project. I worked, but this oral health is a new thing for me. I learned a lot, so I don't know how to ask questions. So learning only I learned because I know only about this ART and just basics of HIV. The wonderful session, ma'am. God bless you. All the best.
Thank you so much, Mary. Thank you. That is why I thought, by creating awareness is how we'll be able to help people understand that we need to really take care and show some kind of an empathy to people who have been affected. Young children are affected. Many people knowingly, unknowingly are affected. So, we need to create awareness. Thank you so much for that lovely feedback. Thank you.
Good evening, ma'am. This is Yamuna here. I'm assistant professor in Arulalandar College, Madurai. Ma'am, I have a query here. The query is, in some cases, there is a higher risk of having HIV for the infants and all. For them, how can we diagnose the symptoms? There is a higher risk of non-identification, right? Because I used to see some kids, even now, who are being infected with HIV and all due to some irresponsible reasons, due to certain reasons that may not be in some cases. How can we diagnose them through symptoms. Do they have the similar symptoms as the adult have?
Thank you for that question, dear. The first thing is generally, if we know who the parents are, we test the adults. And in case the mother has, been pregnant during the birth of this child, then there is more likely that it has been transmitted to the child also. Tests are there where we do the tests and find out. Oral lesions are there, body lesions are there. Like I showed you these, warts, you will have them not only in the mouth, you will have them in the hands, in the body, in the back. So it's quite, when we properly examine the entire body, it is evident, and immunity will be of concern. So these children will keep falling sick, many a times in a month, and sometimes most of them are admitted for other opportunistic infections which they get exposed to. So that is how accidentally sometimes you might encounter children who get affected. So it is very important that we have a kind of a step-by-step approach. So first find out if the parents are affected or carriers, and then you start working on the children and start supporting them with good nutrition, improvise their immunity, and we have seen a lot of people who have been able to lead a very close to near, healthy life if taken care in the and given a proper treatment in the early diagnostic stage itself.
Thank you, ma'am.
Thank you, dear. Any other questions? I think I want to thank Mary and Ravindra sir again for conceptualizing this entire program, and thank you for this wonderful opportunity. It truly means a lot, and thanks to all the delegates and the participants who have sat through the session and listened to my lecture. Any queries, you can definitely contact me. Thank you so much. Over to you, Ravindra sir. Ravindra sir. Ravindra sir, can you hear me?
Dear friends, if you have still more any queries, you can unmute yours or use chat box. Okay, if there are no further queries, we shall conclude this session. Thank you, ma'am, once again.
Thank you so much, sir. Thank you.
Presentation, and we look forward for more sessions in future. We wish you all the success for your future endeavors.
Thank you so much, sir. Thank you.
Thank you, ma'am. Now, dear friends, quickly fill the feedback form for session 2 so that we can move on to next session. Feedback form has been shared for session 2. Kindly fill up the feedback form for session 2. We have 5 minutes. Then we'll move on to next session. By Krishna Manasa. She is a pharmacist. And she would be presenting on pharmacodynamics. Feedback form has been raised in the form of polls. There is a window showing feedback for session 2. If you are not able to see or access the feedback form, you can navigate to polls option, and there you can click on the feedback form window. Or if you are using a browser-based client, if you are logged in from a browser, there may be some technical issues. Kindly use Zoom app. If you have forgot to fill up the previous feedback forms, don't worry. Kindly attend to the present and upcoming feedback forms. Dear friends, quickly fill up the feedback form for session 2. Yes, so we will be moving with our next session. Manasa, you can start your audio, video, and presentation. You can minimize the poll window so that participants can keep filling up the feedback form in the background instead of closing or ending the poll window. You can minimize it and start your presentation.
Okay, sir. Sir, is screen visible, sir?
Yes, ma, please continue.
Firstly, I thank Dr. Ravindra sir for providing me wonderful opportunity to talk on pharmacodynamics on this wonderful platform today, and also introducing me. Thank you, sir, for your kind words. A very good evening to one and all. Today, on the international seminar, my topic is regarding pharmacodynamics. Pharmacodynamics, PD, is the quantitative study of the relationship between drug exposure, concentrations or dose, and pharmacologic or toxicologic responses. We have the 4 stages of pharmacodynamics. Here, we'll see the terminology of the pharmacokinetics and pharmacodynamics, what actually they do. Pharmacodynamics, what the drug does to the body, means it's a biological response, what actually the activity will take place after the drug enters into the body. Pharmacokinetics, what the body does to the drug. After entering the drug, what actually it does. We have 4 categories, like movement of drugs through the body, ADME, absorption, distribution, metabolism, and excretion. Coming to the absorption, it describes how the drug moves from the site of administration to the site of action. For example, if we are considering that have a headache, after taking the tablet, it's supposed to reach the site of action. And distribution describes the journeys of the drug through the bloodstream to various tissues of the body. And metabolism describes the process that breaks down the drug. Excretion describes the removal of the drug from the body. Of course, 100% we never excrete the drug. Still the accumulation will be there inside the body. Medicine in blood. So finally it enters blood to tissues. And pharmacological effects. Desirable effects, therapeutic action, undesirable effects, side effects, local drug toxicity due to accumulation. So we'll see this drug-drug interactions and drug-food interaction, drug-condition interaction. For example, if you are taking the drug with drug, a reaction between 2 or more drugs, and drug with the food, like a reaction between a drug and a food or beverage. A reaction that occurs when taking a drug while having a certain medical condition. Actually, before taking a prescription, we're supposed to clear with the doctor what actually we are taking, whether it's a homeopathy form or Ayurvedic form, what kind of approach we are taking. If not, it leads to side effects and somewhat kind of unwanted reaction will take place. For example, taking a nasal discongestant, if you have a high blood pressure, may cause an unwanted reaction. A drug interaction can affect how a drug works or cause unwanted side effects. Possible effects, like we have chances with decreased action of drugs, increased action of drugs. And sometimes it causes adverse effects. So coming to the human immunodeficiency virus is grouped to the genus lentivirus within the family of Retroviridae, subfamily Orthoretroviridae. It is classified as a retrovirus because it contains liver transcriptase. It is a D-type virus. D-type virus is nothing but dextrorotatory and L is nothing but levorotatory in the lentivirus family. Reverse transcriptase is to convert RNA ribose nucleic acid sequences to cDNA, complementary DNA, deoxyribose nucleic acid sequences that are capable of inserting into different areas of the genome. For example, carrying the or transforming the information from the DNA to messenger RNA is transcription. Getting back the messenger RNA to DNA is translation. But here this is retrovirus. Because of that particular reason, the messenger RNA will retrace back to the complementary DNA. Is nothing but copy of DNA. This is how it works. But the reverse transcription is used by the retroviruses to incorporate the genes into those genomes. So complementary DNA, cDNA, is a DNA copy of a messenger RNA, mRNA molecule produced by reverse transcriptase, a DNA polymerase that can use either DNA or RNA as a template. Human immunodeficiency virus is a virus that attacks cells that help the body fight infection, making a person more vulnerable to the other infections and diseases. Can drug-food interactions and drug condition interactions affect people taking these medicines? Yes. By using this can lead to both drug-food interactions and drug condition interactions also. Food can affect the absorption of these medicines and increase or reduce the concentration of the medicine in the blood. And depending on the medicine, the change in the concentration may be helpful or harmful. So the directions on how we take, like whether there has to be take the medicine with food or an empty stomach, we're supposed to ask the doctor clearly before taking the prescription how we're supposed to use the tablet. What are the preliminary timings, like before the lunch or after the lunch, with food or without food, we're supposed to ask. And some virus medicines can be taken with or without food because food does not affect their absorption. Conditions like such as kidney diseases, hepatitis, and many more can affect how the body processes on virus medicines. The dosing of some these viruses medicines may need to be adjusted in people with certain medical conditions. So is there any cure? Nothing like that, but these are the following steps to avoid some drug interactions. Tell your healthcare provider about all the prescription and non-prescription medicines you're taking or plan to take. We have to give them a clear-cut clarity. If not, again, it leads to unwanted side effects. Also, tell your healthcare provider about any vitamins or nutritional supplements and herbal products you take. People may think that herbal products, they never disturbs a lot, but if you're taking any chemical drug, so with the combination of herbal drugs, if you take, it leads very adverse effects and gives you unwanted serious reactions. So tell your healthcare provider about any other conditions you have, such as high blood pressure or diabetes. So the treatment of this viruses is called antiretroviral therapy. ART involves taking a combination of virus medicines called a HIV treatment regimen every day. ART is recommended for everyone who has this, and people with this should start taking medicines as soon as possible. And it cannot cure, but at least the medicines will help with live longer, healthier lives, and also reduce the risk of this transmission. The main goal of a virus treatment is to reduce a person's viral load to an undetectable level. Actually, how it enters into the T cell. As all we know, the docking two or more molecular structures will come and hit to the CD4 receptors. Actually, these receptors are especially plays a crucial role in the immune system. And these core receptors are the accessory receptors. It never involves in signaling, but indirectly bind to the ligand. So after that, it gets fused. As all we know, the viral RNA proceeds with the reverse transcription will get the complementary DNA. It's a single standard DNA. After the process, it becomes like double standard DNA. It goes and fuse and get interaction with this chromosomal DNA, and the provirus will start. So it attacks and destroys the infection fighting CD4 cells, CD4 T lymphocyte of the immune system. Loss of CD4 cells make it hard for the body to fight off infections and certain virus-related cancers. These medicines have prevent, but from multiplying, making copies of itself, which actually reduce the amount of virus in the body, called the viral load. Having less of this in the body gives the immune system a chance to recover and produce more CD4 cells. Even though there is still some virus in the body, the immune system is somewhat strong enough to fight off infections and certain virus-related cancers. By reducing the amount of virus in the body, these medicines also reduce the risk of HIV transmission. In fact, there are many medicines available for this treatment regimens. Medicines are grouped into 7 drug classes according to how they fight. So the choice of a treatment regimen depends on a person's individual needs. So when choosing this virus treatment regimen, people with this and their healthcare providers consider many factors, including possible side effects of virus medicines and potential drug interactions. So these are the 7 kinds of drug classes like NNR, TIS, and TIS, PIS, and fusion inhibitors, CCR5 antagonists, INSTIS, post-attachment inhibitors. In fact, taking these medicines keeps people with healthy and prevents transmission. Taking virus medicines every day and exactly as prescribed, called medication adherence, also reduces the risk of drug resistance, but still sometimes can cause side effects also. So most side effects from this virus medicines are manageable, but a few can be serious. Overall, the benefits of these medicines far outweigh the risk of side effects. In addition, newer medicines also cause fewer side effects and then medicines used in the past. So we have to be very careful while using these medicines. And treatment continues to improve. People are less likely to have side effects from their medicines and can interact with other medicines in a treatment regimen or with other medicines a person is taking. So healthcare providers carefully consider potential drug interactions before recommending a virus treatment regimen. So the United Nations and the United States, based on the United States Development of Health and Human Services, the medicinal practice guidelines, all of these drugs are absorbed by the US Food and Drug Administration. So these are listed by their brand names based on their drug classes. The first one, nucleoside reverse transcriptase inhibitors, brand names Ziazin, Emitril, Epivir, Viread, and Retrovir. And the non-nucleoside reverse transcriptase inhibitors like Felotro, Sustiva, Intilens, and Edurant. Coming to the protease inhibitors, Lexiva, Reatase, Norniver, fusion inhibitors like Fusion, and CCR5 antagonists like Celesentree, integrase stand transfer inhibitors like Vocabria, Isentrins, attachment inhibitors like Rucobia, and post-attachment inhibitors like Trogarzo. And these are my references. Once again, I thank Dr. Ravindra sir for giving me this wonderful opportunity, and thank you all.
So dear friends, so we will move on to our next session. By Mary Florence Frida. She has over 16 years of professional social work experience. And she would be presenting on Yeah, Mary, you can unmute yourself, start your audio, video, and presentation. Over to you.
I'm going to present on HIV/AIDS prevention and ART therapy. I thank Dr. Ravindra sir and his team for giving me opportunity to present on this wonderful AIDS Prevention Day, World's AIDS Day, and I'm going on to my presentation. First, I start with what is HIV. HIV is a human immunodeficiency virus. The virus comprises the body ability to handle disease and cause AIDS. AIDS is acquired immunodeficiency syndrome. It is related to HIV and they are not one in the same. A person has AIDS only in the final stage of HIV after the immune system becomes unable to defend itself against foreign invaders like bacteria, other viruses, and also the development of certain cancer. Since 1981, 1.7 million people in the US are estimated to have infected with HIV. 1 in 5 those infected are unaware. Men who have sex with men accounted for 61% of all new HIV infections in the US in 2009. Over 6,19,000 with HIV have already died since the pandemic epidemic began. Ethology, the world famous aware of AIDS in the early 90s, researchers aren't sure exactly when and how HIV developed. The most likely theories assume that HIV-1 was transmitted to humans and humans from chimpanzees sometime in the early 20th century. What are the symptoms of HIV? When HIV emerges from latency, the period when someone with HIV knows signals of it, symptoms can include dry, flaky skin, chronic fatigue, fever that comes and goes, diarrhea that lasts more than 1 week, heavy night sweats, rapid weight loss, swollen lymphocytes, white spots on tongue, mouth, and throat. What are the diagnoses of HIV? To be tested for HIV, usually a simple sample of blood, urine, or a SAM of fluids from your mouth. It is recommended that if you are sexually active or have multiple partners, you should be tested every 6 months. There is no cure for HIV. Antiretroviral can reduce the presence of virus in the body but not eliminate it. The prognosis of those with HIV is improving, and the development of antiretroviral drugs that help reduce the amount of HIV in the blood to an undetectable viral load. What is the prevention? Prevention factors to prevent HIV transmission during sex, you need to use a condom. HIV can be spread through vaginal, anal, or oral sex. Open source from STDs like herpes or syphilis provide gateways for HIV to enter body. Gonorrhea and chlamydia can weaken the skin and mucous barriers that help prevent infections. If you inject drugs, use a new sterilized needle each time to significantly reduce the risk of HIV transmission. HIV is not airborne and cannot be taught by touching skin. sweat or saliva. You cannot get HIV by holding hands or sharing drinks. Mosquitoes do not inject other people's blood when they bite, but also spread HIV. Actually, I want to share my personal experience, which I worked in Samraksha Clinic in Bangalore. There I was in the art counseling. Uh, there the doctors, when they prescribe medicines, they say that the timings of the ART tablets is very, very important. Like if morning 8 o'clock they have taken, again they should take correctly at 8 o'clock night. 1 minute here and there also the virus will get infected. And in Bangalore, the host centers for this one is John's, Bowring, and Matas, and this Kidwai Hospital. And plus, they said you should eat nutrition food like vegetables. And you should not give gap between too much gap between meals. You should always take fruits, vegetables, and full meals to get the nutrition. And you should be very careful while if you are going to have a child. You should really plan it, otherwise it will affect the child. Because in our my own building, we have families who are affected with HIV, and all lost husbands. And we having a family counseling center where that we having giving counseling to the HIV families, like how they can be an inspiration for others, how they can how they are leading the life. Each one is working, and they are giving awareness in the villages how HIV is spread, can be cured, and they give awareness programs. And plus they speak about the art therapy in St. John's, and they do voluntary work. And plus now that NGO's name is Action Aid, and it is spread all over Karnataka and Bangalore also. This is my personal experience, sir. Thank you very much once again, sir, for giving me the wonderful opportunity on the occasion of Azadi Ka Amrit Mahotsav. Thank you very, very much, sir, once again. Sir, I finished, sir. Sir, are you there, sir? Hi, sir. Are you there, sir?
Yes, so we will congratulations, Mary, on your presentation.
Thank you very much, sir,
All
for
this
the
is-
opportunity given to me.
Thank you, ma'am. So with this, we shall conclude this seminar. Thank you everyone for joining us for the International
There are
Self.
only 10 people in this world.
Kindly fill up the overall feedback form. You can download your certificates from the website after 15 working days. You can visit our website and navigate to respective page as per date. From there, you can find the Google Drive link from which you can download your certificates.